Well, there are two forms of distortions. First is systemic error, which is bias. When you have a data set where rare diseases are, let's say, or not only underrepresented, but also there is a tendency to misdiagnose a certain kind of diseases in a special situation. And if this tendency is in the data set, then there is a bias. For example, some lesions are more difficult to diagnose, and in some lesions, the ground truth, meaning pathology, for example, is not as golden as it seems. Let me give you an example. We take usually the ground truth, the histopathology is ground truth. The histopathology is clear-cut in basal cell carcinomas or squamous cell carcinomas. There is usually no room of doubt. But in the realm of melanocytic lesions, there are lesions that cannot be diagnosed with certainty as either benign, nevus, or malignant melanoma. And there's, so to speak, a gray zone. And there is, in some countries, a tendency to shift the diagnosis towards the more darker end of the gray zone, meaning to overdiagnose melanomas. So this is a systematic error that is included in the training set, and therefore it also plays out in the test set or in the sets that we encounter in clinical practice, and the diagnosis will be biased. Because unfortunately, usually more data means it's good. Because why? Because why is it good? Because the error cancels out. But if you have a systematic bias, more data is bad, because the systematic bias is reinforced. And then there is a bias because of underrepresentation. So this is a different kind of distortion. So rare diseases or common diseases in a situation, or common situations for common diseases, for example, that are uncommon in a certain group of patients, they are underrepresented. So if you collect a database of skin cancer, naturally patients with dark skin will be underrepresented because they don't get skin cancer that often. On the other hand, also children will be underrepresented because they don't get skin cancer that often. What I want to say, there is ethnic bias, but also age bias, but this is not on purpose. This is the nature of the problem. But of course, we also have to deal with rare situations sometimes, where you have a set of patients who are underrepresented in the training set, either specific ethnic groups or specific age groups, or in other diagnoses also underrepresentation because of sex. So these are problems we have to deal with, and these are very complex problems, because if we artificially increase the number of patients who are usually underrepresented, then there will be a bias in the other direction that we also don't want. So this is a very complex matter, and we didn't sort it out efficiently currently. But one way to sort it out is to have more representative data set, but this is not the only solution.